Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Leading NP expert Dr. Margaret Fitzgerald shares her knowledge and experience to help you dissect the anatomy of a test question, so you can better understand how to arrive at the correct test answer. So if you're ready, let's jump right in.
A 9-year-old female presents for well child care with her parent. She's in the 4th grade, doing well academically, plays soccer on a local team, and reports, "I have 3 best friends," close quote. Health history per parent and child reveals no concerns. On physical exam, the clinician notes that the child is at about 40th percentile height and weight for age, has breast budding and downy, straight, slightly pigmented pubic hair along the labia majora. These findings are consistent with A, precocious puberty, B, early onset normative puberty, C, age-appropriate pubertal findings, D, concern for a gonadotropin releasing hormone lesion. And the correct answer is C, age-appropriate pubertal finding. Where should we start with a question like this? First, determine what kind of a question it is. This is one of those questions that straddles between differential diagnosis. It's likely not the appropriate term because we're talking about what sounds like a really healthy child, an assessment, in other words, findings on her physical exam that are age normative. Providing well child care is truly one of the greatest joys of practicing in family primary care. I say this as a person who's had the privilege of following some families for more than 30 years and caring for multiple generations of children. While we need to be alert to issues of concern, part of our role is to be aware of what's normative so we can provide appropriate counseling and reassurance. That's what's at the core of this question. Is this child on target or is there a problem? Puberty is part of the process of physical changes in the body where the child matures and transitions into an adult body capable of sexual reproduction. This occurs through a complex process with an interplay of the brain and the gonads. While the terms puberty and adolescence are often used interchangeably, puberty, by definition, is focused on the development of secondary sexual characteristics and attainment of reproductive capability. And adolescence is a term that's more inclusive of the psychosocial as well as the physical development. Puberty consists of a series of fairly predictable physical development of events outlined in the Tanner's stages, also known as the sexual maturation rating, or the SMR. There are 5 Tanner's stages, from Tanner's 1, prepubertal, in other words, the body of a child with no secondary sexual characteristics, Tanner's stage 5, which is full adult. And given that we understand that Tanner's 1 is, that would be a child with evidence of no pubic hair, no growth velocity, and in a female, no breast development, and we know what adult sexual secondary characteristic maturation looks like, what you really do need to learn is what Tanner's 2, 3, and 4 look like. Regardless of birth gender assignment, Tanner's 2 marks the onset of pubertal changes. This question in the podcast is focused on recommending the normative pubertal onset versus what would be of concern. In females, the earliest Tanner's 2 changes, including breast budding, and the development of what looks like pubic hair but tends to be shorter, straighter, with light pigmentation and along the labia majora only. At this point, there might be a minor increase in growth velocity. And so you're looking at this and you go, yeah, but the kid's only 40th percentile height. Wait, remember that the growth spurt starts at Tanner's 3, not Tanner's 2. And so normal onset of Tanner's 2 staging in females happens between the ages of 8 and 14 years. In other words, an 8.5-year-old girl who's Tanner stage 2, perfectly normal, but so would be a 13.5-year-old who's Tanner stage 2. By the way, quite often you will hear people refer to as the onset of puberty in females as marked by the first menstrual period. That's also incorrect. The first menstrual period, or menarche, typically occurs about 2 to 3 years after the onset of Tanner's 2 changes. And so if I was to predict with this child today, given she's 9 and Tanner's 2, she will be probably 11 and maybe as late as age 12 when she starts her period. It's usually more like 2 years after the onset of Tanner stage 2. Early onset, or precocious puberty, is defined as the onset of the secondary sexual characteristics in female before the 8th birthday. Though there is a trend to state that most who have breast budding between the ages of 7 and 8 have normative puberty variant. As a result, the most common reason for precocious puberty in females is early onset normal puberty. In females age 6 or younger with pubertal changes, there usually is significant underlying pathology, and referral to pedi endo is the rule. With this information, let's take another look at this question. A 9-year-old female presents for well child care with her parent. She's in the 4th grade, doing well academically, plays soccer on a local team, and reports, quote, "I have 3 best friends," close quote. Health history per parent and child reveal no concerns. On physical exam, the clinician notes that she is at about 40th percentile height and weight for age and has breast budding and downy, straight, slightly pigmented pubic hair along the labia majora. These physical findings are consistent with A, precocious puberty, and this is, of course, incorrect. Precocious puberty is defined as secondary sexual characteristics in the female, depending on whose work you look at, prior to the 8th birthday, and it might even be as low as prior to the 6th birthday. B, early onset normative puberty. That's also incorrect. She's well within the bell curve, if you will, for onset of puberty. Very often, the parent and the child will need some reassurance that these changes are perfectly normal in a 9-year-old, and in fact, normative, but they don't qualify even as early onset. C, age-appropriate pubertal finding. This is, of course, the correct answer. You could also follow up at this visit and ask when these changes occurred, and you'll probably hear just a few months ago. And then that can open up a dialogue about anticipating onset of menses within the next 2 to 3 years. As I said, probably more like 2 rather than 3 years, and when the child's growth spurt will start over the next year or so. These are just such helpful pieces of information to share with child and caregivers to reassure them that this child is spot on track-wise. By the way, I smile even looking at this. It's very common for kids this age to have multiple best friends. And in fact, it is a wonderful marker that they are socializing appropriately for a child of this age. And then D, concern for gonadotropin producing hormone. This is, of course, incorrect, as this scenario presents us with a healthy child with no particular concerns revealed. Key takeaway: so often in healthcare, we're focused at looking at something that is a problem or a concern, but we also have to remember, particularly when providing well child care, most kids are healthy. And knowing what's normative in the physical exam is key to safe and effective care and counseling.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.